there are two major factors that I would say play the biggest role in longevity of restorative work, especially in cosmetics. And the first is occlusion. The other important factor is bonding and establishing good bonding protocols. And we're going to focus our attention on bonding. Basically, the biggest difference between direct and indirect bonding when we're talking about cosmetics or really any kind of restoration, the bonding to the tooth is actually the same. The protocols are very similar. The only difference is when we're doing an indirect restoration, we also have to prepare the intaglio surface of the restoration. But in terms of what our process is, this is my general flow of how I go about ensuring long-term success for my restorations. When it comes to understanding your bonding protocol, this varies depending on what materials you're using. I like the All Bond from Bisco, and the best way to operate that protocol is to actually put two 20-second coats of the adhesive layer on, and then we air thin. And to prevent, collapse of the fibrils, I actually have my assistant come in with a high-speed suction and come in, and I will come in from a distance and kind of slowly come in with my air to get that solvent evaporated. Before I actually cure my adhesive, I put some Teflon tape interproximally just to, again, protect my adjacent contacts and make sure that we're not accidentally bonding the teeth together, especially on the mesial of 11, where we just added those composite restorations. So when we talk about restorations, it's really important to kind of think about it as, what do we do for a retentive versus a non-retentive prep? So when we're talking about retentive versus non-retentive, we're talking about basically crown versus veneer. And you need to think about, are you doing an all ceramic restoration versus something like a metal ceramic? Are you doing a PFZ or PFM? Or are you doing a full contour zirconia crown? You're going to treat the inside of the intaglio surface of that restoration differently than you would for a feldspathic or a lithium disilicate. So when you think of retentive versus non-retentive, you really got to think about, am I bonding the crown in place or am I kind of cementing the crown? But kind of old school mentality is let's cement it. This is kind of where our resin modified glass ionomers were. However, we still have really good self-cure cements that, are good options for retentive preps where you don't need that extra layer of bond. For non-retentive preps, this is where you're relying a little bit more on the chemical bond strength versus the mechanical bond strength. So there's a few more steps. Personally, I like to kind of treat everything like a non-retentive unless there's a really good reason to go with just the retentive prep, whether it's, maybe a second molar where it's fairly deep and I'm really relying more on that self-cure, trying to get that added fluoride exposure with the cement. I'm pretty much going with the non-retentive bonded option.